first, let's welcome Dr. David Schmitz with Novant Health, Oceanside Family Medicine, right here in Bolivia.
Hi.
Hi, thanks for coming.
My pleasure. Thanks for having me.
I'm excited to have you. I want to start with learning about you because our viewers are always interested in like where you grew up and where you went to school.
Sure. So I actually grew up in the suburbs outside of Chicago. Did most of my formal education, college in that same area, and then attended Chicago College of Osteopathic Medicine through Midwestern University in Downers Grove, and then did my initial residency and training at a hospital on the south side of Chicago.
So pretty much in Chicago.
Yep, Chicago born and bred.
So tell me, what drew you to become a family physician?
Through training and med school, I noticed a large opportunity for an advancing population that needed more representation and monitoring. And a lot of my classmates were looking to go into specialties, cardiology, respiratory, leaving a large gap that needed to be filled, and I felt that I could provide the best need for the population in that role of managing and making sure patients stay healthy, so they need to see specialists as little as possible.
That's right. And you have the personality to do that because people, it seems to me that people find you easy to talk to. You're very open and engaging. So.
Thank you. Well, I had, previous life experience doing construction work and laboratory work and just keeping grounded. So,
Yeah. Well, that makes for a great family physician, though, when they listen and understand what you're trying to tell them. So, well, you were kind enough to come on today to talk about Men's Health Month, which is June. And tell me why you think it's important for men to take an active role in their health care. I know just from a personal experience, if it weren't for me, my husband would have no health care. So just saying.
That tends to be the similar thing. I usually hear, well, my wife sent me to make sure I was healthy.
That's right.
And it's important because, men are typically seen as being the tough providers that can weather any storm, and they ignore the little things they should probably pay attention to sometimes before they become too big. And unfortunately, even with our society and our advanced medical technology, men still die on average 5 years before their female counterparts because they aren't being screened early enough to catch things and manage them before they get bad, leading to rougher outcomes and control. So having men be seen at least once a year, if you're healthy, more often if there's anything going on, to stay ahead of the disease process so that we don't have to chase it and try to make it better. We keep it from getting bad.
So you would recommend that everybody have a yearly wellness physical.
Oh, absolutely.
In addition to just seeing their primary care afterward.
Usually the primary care does the annual physicals. Yeah, absolutely. And then
continues to see it.
Absolutely. And then if anything is advancing and we need to incorporate the specialist, we can get you to there, direct you to the ones that we feel would best help after that. But the annual physical allows us the ability to ensure everything's normal and nothing's getting out of hand before it's too late.
So how in-depth is an annual wellness physical, and there's lab work and all sorts of things that go on, right?
If you watch TV and movies, it looks very invasive. It's not that bad, actually. It really is coming in, making sure we're talking about diet, health, exercise, lifestyle. We get lab work to check all of the organs, their functionality, and then kind of reviewing the systems, listening to heart, lungs, abdomen, and just having a good conversation with the patient, allowing them to the ability to say, I did notice this one little thing, because that's really what we're looking for. What is that one little thing, and do we need to check up on it?
Well, let's talk about some of the screenings that are really, really important for men, such as prostate, and what else is in that falls in that category.
Depending on age and family history, men should start getting their prostate exams at age 50.
Okay.
If everything's normal, you get another PSA every 2 years till the age of 69. For high-risk populations, such as African American men and any man who's had a relative, such as a father or a brother, who had prostate cancer before the age of 65, we start screening them at 45. And any at-risk population with a family member who had prostate cancer before the age of 55, we start at 40. Similar to colonoscopies, which start now at age 45 and go through 75, unless there's anything more advanced that continues further, or, heaven forbid, somebody had a family member with colon cancer in their 30s or 40s, you start 10 years before that diagnosis to make sure you catch anything like that early.
So just because you don't screen after 75 doesn't mean you wouldn't be able to have one if you have a situation.
If symptoms show up, we can test anything at any age.
So you may have to. That's not my favorite thing, you know.
Well,
I know most people.
Most people don't.
Thing,
but would you rather get screened or have cancer?
Yeah, true. Well, with the lab work, usually you do urine and blood. What are you looking for?
We technically don't do a lot of urine anymore.
Really?
Unless there's a urinary symptom.
Okay.
It's not very, doesn't tell us very much. The lab work itself has advanced so much that we look at CBC to make sure iron concentration, red blood cells, everything there looks normal. A comprehensive to make sure we check out kidneys, liver, pancreas, electrolytes, cholesterol levels, and then any specialty things should there be an additional diagnosis.
That's a lot. But you are the driver. I mean, primary care is the driver. If everybody had primary care, we would have a lot less business for specialists.
Technically, yeah. You know,
I mean,
we're the
possible.
gatekeepers
You
that
are.
watch the medical community to make sure everybody stays healthy.
That's why it's so important for everyone to have primary care.
I
I've
agree.
always had one, and he's the driver. Whatever he says, this is what we do. Do you have any tips on mental health?
Yes, don't ignore it.
Yeah,
it's an important thing, and it can affect everybody's lifestyle in ways that we wouldn't even imagine. So always bring up any concerns during your annual, or make a special visit if you feel that it's something you even might want to talk about. It's an important conversation to have.
I think it's a hard one, but
it is.
But it is a very important one.
Yeah, every conversation's hard, but you have to find the right person to talk to.
That's what I say. The great conversationalists would make the best
That's right.
primary care physicians. Well, thank you so much for coming today. I really appreciate your time. I hope to have you back real soon because I hear that there's a new building in the works and there'll be new offices and you'll have one of them.
I will.
That'll be great.
Too.
So hopefully we'll see that real soon.
Great. Thanks so much.
Thank you.